Okay, so the last and the most important one among the cyanotic heart diseases is the teratology of Fallot. Now, teratology of Fallot, the main thing that you have to remember is right ventricular hypertrophy. So, right ventricular hypertrophy, because of why does it happen? Because of silvery. It is the four components. First of all, you have severe pulmonary stenosis, which can develop into right ventricular hypertrophy, and it is associated with the VST and overriding of aorta. What is the overriding of aorta? Is nothing but aorta will open directly into the VST. That is only the overriding of aorta. Now, symptoms is nothing but, yes, it's a cyanotic heart disease, but you will not have cardiomegaly. Now, it does not have cardiomegaly and it does not have increased pulmonary blood flow. So, this is the only cyanotic heart disease with no cardiomegaly, and also not and no cardiomegaly, and yeah, that's about it. Now, other thing is that important thing is it will present with dyspnea and anoxic spell, squatting and convulsions. Now, this anoxic spell is very important. While squatting, it's also very important. You'll have convulsions, it's very important. Now, this is the four components of TOF. There is also known as 5 components, where in the fifth component you will also have an AST. Now, the cyanosis will present for the first year of age. Now, if you talk about the heart sounds, S1 will be normal, S2 will be soft, but if the pulmonary stenosis is severe, you cannot hear the P2. Shunt murmur, it can be silent because of the large VST. Flow murmur is present as ejection systolic murmur at pulmonary area, and because of right atrial pressure is more, you will have A wave in JVP, and it's a boot shaped heart. Now, why is it a boot shaped heart? Is because of it's also known as Coren boat. It's nothing but how do you say it's a boot shaped heart? Is that there is no cardiomegaly, so you cannot say there's a cardiomegaly, and that is why there's boot shaped heart. Now, there's because of absent pulmonary markings. Absent pulmonary markings, pulmonary bay is present, dark lung will be present, pulmonary oligemia present. Now, because of the right ventricular hypertrophy, it provides the apex of the heart is a bit tilted up. That is why it's a boat shaped heart, nothing else. Now, what is this anoxic spell? Anoxic spell is nothing but baby cries is incessantly. That is around 4 to 6 months, and you'll have cyanosis. Now, what do we do is that you give oxygen for the baby, and then you tell the baby to sit in the squatting position or a knee chest position. What happens is that when you do that, the systemic vascular resistance will increase, and the flow to the heart will be rapid and more, and you should decrease the stress of the heart by giving morphine. Now, one of the important thing is that you should give only beta blockers, that is propranolol, and you should not avoid drugs like beta agonists, that is isoprenaline and all that. At 4th month of age, you can do intracardiac repair, and you can close the VSD, and you can minimize the pulmonary stenosis. And also, you can also give drugs to decrease the pulmonary stenosis, which is by alpha agonists. You can give an alpha agonist, you can give phenylephrine, sodium bicarbonate, and all that. Again, you do a Blalock toxin shunt. Blalock toxin shunt, you also do it in I think you do it in do we do it in PTA or what? No. Blalock toxin shunt it, right? So, just a minute. We have to see where it is now, because I go insane if I don't find out where I do the Blalock tossing shunt. So, it's not VSD, yeah, it's not ASD, and it is not PDA also. So, is it no, it's not coagulation of aorta. Is it TGA? No, you don't do Blalock tossing shunt in TGA. It is not in TAPVC also. Yeah, because in do it in DAPVC. So I do this block tossing shunt. Yes, we do block tossing shunt in the tricuspid atresia. Very important. Yes, we do it in similar to that of TOF. Exactly. Okay, good. So let me just so we do blood oxygen to connect the subclavian artery to the pulmonary artery. Okay, in another corrective surgery, you can do Waterson's and POTS, where aortic artery is connected to the right pulmonary, descending aorta to the pulmonary artery. Now, I've told you already you can have convulsions. So, if you have convulsions, altered sensorium fever, cerebral abscess, these are all, it can complications of TOF. Fever, no fever, altered sensorium convulsions, you'll have cerebral venous thrombosis, stridor, absent pulmonary valves, tortuous pulmonary artery over the trachea that can cause stridor, hemiplegia because of thrombosis and anoxia, and complication you can have infective endocarditis along with which is that of a VSD. Now, why do we have these thrombosis and all? Because in most of the cyanotic heart diseases, because of hypoxia, that is in be it TGA, be it TAPVC, be it TOF or tricuspid atresia or truncus artery, whatever it is, hypoxia will cause polycythemia, which will increase the viscosity and will increase the thrombosis. So, to always remember, the risk of thrombosis is seen in cyanotic heart diseases. Uh, so also in TOF, CCF is less likely to occur because I told you there's no cardiomegaly. Now, if the CCF occurs in TOF, you should consider severe anemia, infective endocarditis, secondary systemic hypertension, myocarditis, and valvular regurgitation lesions. So that's it. Yeah, and here you'll have right in ECG, you'll have right ventricular hypertrophy and right atrial. Uh, I mean, right axis deviation. Right axis deviation will be C.